Hi everyone! As you probably know by now, I study dentistry, and one of the most common questions I get asked is, how did I choose dentistry? Why did I not choose medicine? So I asked on Instagram whether it would be a good idea to have a video explaining how I chose my major in case some of you are wondering whether to choose between the two, and 100% of you said yes. So here's the video that I promised I would make. Although medicine and dentistry share a lot of similarities, I think there are a few important fundamental differences that should be considered before deciding which one to study. Growing up, dentistry wasn't something that was on my radar until probably the middle of high school. When I was very young, I wanted to be a journalist, and everyone in my family and extended family had backgrounds in like banking or finance. No one was a healthcare professional. So I grew up watching Bloomberg and reading about the stock market and the Financial Times, and I had no idea what an artery was or how cardiac output is calculated until I started biology at school. I did spend a week at an investment bank and I did not enjoy myself, so I quickly realized that an office job probably wasn't going to be the perfect fit for me. The person who really exposed me to the field of dentistry was my own pediatric dentist. She was so incredibly friendly that I used to love going to the dentist as a kid, and I think that's really important because I meet a lot of people every day who are like, I hate going to the dentist, and usually it's because they've had some sort of traumatic experience as a child which made them connect dentistry with suffering. But for me, it was always a very happy experience. She was very knowledgeable, and I was a very curious child, so I used to always ask, like, what does this procedure do? What is this instrument for? And she would always take the time to explain things to me. That definitely inspired me, and I wanted to give others a positive experience too, by focusing on prevention and teaching them to take care of themselves so they don't have to wait till their oral health really deteriorates and they won't have to associate each dental visit with fillings and extractions, so fewer people are anxious and start avoiding the dentist altogether. When I was around 13 or 14, my pediatric dentist became my orthodontist, and she offered me the chance to spend part of my summer at her clinic to get to know her daily work a little bit better. A lot of her patients were my age, and I got to see firsthand how orthodontic treatment really impacted their lives. It wasn't just about alleviating pain anymore, but also by shifting their teeth into a proper alignment, she was able to improve their self-confidence and really change their whole appearance. I saw people who were really embarrassed by their teeth, who started avoiding smiling altogether and talked very little, and you think that they're just shy, but after orthodontics you can see that they kind of become a whole new person. They do like that whole 360 in terms of character. Cosmetic dentistry is definitely not just about beauty and appearance. There's also that psychological aspect to it. You can really improve someone's overall well-being. And obviously there's that functional aspect as well. You can really help to improve someone's life by helping them correct their chewing or speech. And I was just amazed at how important the oral cavity actually is. I mean, like, you spend 7% of your day enjoying meals, and if you lose the function of your teeth, you can barely even eat. This enlightening job shadowing experience was around the time that I started choosing subjects in high school. I liked biology and chemistry, but I knew I didn't want to study a pure science degree because there's a lot of lab work involved, and I wanted a job that had more patient contact or more human contact. I wanted to really make a difference to someone's life and be able to diagnose and treat different diseases and to learn about the human body. Clearly, dentistry is not the only subject you can study where you can do this. Medicine is for many the more obvious choice, and I did consider medicine because the subjects I did enabled me to go for both. While dentistry was always my first choice, a lot of my friends in dental school actually had the option of going into medicine or dentistry, but eventually chose dentistry. I know that if you're applying to either one, you might be wondering if the other could be a better option. So in no particular order, here are some of the reasons why I chose dentistry over medicine. The biggest reason that comes to my mind right now has to do with life and death situations. I think everyone's path in life is somewhat influenced by their childhood experiences, and I know mine certainly was. Around the time when I was deciding whether to go for med or dentistry, a very close friend of mine became seriously ill and had to leave school to go to hospital for 4 years. and she actually went into a coma for almost a year. And to say that I was upset is a bit of an understatement, really. I became very dysfunctional when I was preparing for my interviews. I just felt like crying all day, and I really couldn't stop thinking about it. That's when I had that moment of realization that I really couldn't be a doctor. Medicine is just so much more than academic potential and meeting the requirements and getting good grades. It's a lifelong commitment to serving people, and you can't let your emotions get in the way of your work. You have to have a certain character where you can dissociate, like separate your personal life from your professional life. And I felt I would really struggle with that because, especially at the time when I was applying for university, I was like really upset by this experience that impacted my friend. So I literally could not read about young people dying or watch it on the news or see it in movies without feeling really sad. I definitely think it would have impacted my day-to-day work if I had become a doctor, which wouldn't have been good for anyone, not my patients and not for myself either. Healthcare is an imperfect science. It's made up of inadequate information, ambiguous research, and your knowledge and ability is never going to be perfect. Even the simplest operation can't be taken for granted. Even in dentistry, there can be complications, and I mean, obviously if a patient comes in with severe tooth decay, that can be very painful. But in most cases, there is a sure fix. There is that immediate relief you can provide by quite literally taking things into your own hands. Medicine can be quite drug-based, so like you prescribe a lot of medication, whereas for dentistry, you can alleviate the problems using your own manual dexterity, and often relatively quickly as well. I know there are a lot of exceptions to this, especially if you specialize in surgery, but I'm just speaking in general terms. Like, obviously a general dentist uses this sort of like hands-on work a lot more than a general practitioner. So yeah, I do think that there is to an extent more certainty in dentistry, and it can be very rewarding to see the impact of your own hands-on work on your patient's quality of life. I think in terms of what you learn in medicine and dentistry in the first year, it's actually quite similar. And there are lots of reasons for this. There is research that links gum disease with cardiovascular disease and obesity, and diseases like diabetes and cancer can also really affect your oral health. So you do learn a lot about the human body with particular focus given to anatomy, biochemistry, and physiology. So if you are into learning about the human body and how it works, then you should definitely consider either of these courses. What is very different though is the type of job you will get into afterwards. In medicine, you start off working in a very big hospital surrounded by lots of people, very interdisciplinary, whereas in dentistry, in Hong Kong at least, 73% end up in private clinics, which is a much smaller working environment. You normally just have your DSA, your dental surgery assistant, and you know, like some nurses, some receptionists, lab technicians. I think also what influenced me to a small degree was my interaction with my doctors and dentists in the past. As I said earlier, my dentist was always super cheerful, super happy. Everyone working with her, like the other dentists, the other dental nurses, they all seemed to be enjoying themselves and having a good time. Like you could tell from talking to them that they loved their job. Whereas whenever I asked a doctor about his or her work, they were always like, don't do medicine, I'm stressed, I'm really tired, I have no work-life balance. So it just seemed obvious to me which one I wanted to go into as a 13-year-old. If you have good manual dexterity, you'll definitely enjoy dentistry. It's much more artistic than you think. You use so many different materials and so many different instruments, and you do carving and shaping on a daily basis. There is a lot of tooth morphology, and you have to be so accurate all the time, so you definitely do need good spatial awareness. Both subjects are constantly evolving, which really fascinated me because when I first started, I remember one lecture when the professor was like, this research just came out a couple of years ago, and I couldn't help wondering what the students 2 years ago learned and what the students 2 years younger than me are going to learn. You realize that you are at the forefront of a field that has so many possibilities yet to be discovered, which I really love because I want something that will challenge me and help me grow and develop throughout my entire career. Ultimately, no matter what career you choose, it's going to be a big commitment. So I would definitely suggest doing some research. Talking to dentists, talking to doctors will really help, especially if, like me, you don't have anyone in your family who is in healthcare. Make sure you are studying some sort of science because it's going to be really hard to get in if you don't have a background in biology and chemistry, although like the requirements do change according to which school you apply to. Also, I just realized I didn't mention veterinary science at all, which is another option if you do like science, but I personally did not want to work with animals, so that was out of the question. Don't do dentistry because you think medicine is very tough to enter. That is not a good reason, and if it's the only thing you say, you are bound to be rejected. Dentistry is a part of medicine, and like I said earlier, a lot of the times you learn very similar things, and in some cases you might have to do clinical work in your first year as well as learning the medical stuff. The entry requirement for dentistry is slightly lower in some cases, but this isn't something you should only look at because there are only a handful of dental schools around the world compared to medical schools, and if you look at the ratio of the applicants to the number of places, dentistry is a lot more competitive than it seems. So my advice would just be to not choose based on what you think your chances of getting in are. You should really choose based on what kind of work you want to do in the future, what kind of work environment you want to have, and whether you want to be more hands-on or more research or more clinician and GP. And if you really are interested, it will show in your application, which will increase your chances of getting in no matter what subject you choose. I hope this video was helpful. This was just my personal experience, obviously. I'm not trying to say any subject is better. I really respect doctors, and a lot of my friends are studying medicine. But this is just kind of my story of how I chose my university course. I think everyone will have a different experience.